Welcome to the Victory Education Lounge. I'm your host, and today we're diving into a critical topic that often flies under the radar: metabolic acidosis and insulin resistance. This is part 98 of our ongoing series on metabolic health. Before we begin, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us reach more people with this vital information. Many people don't realize the significant connection between metabolic acidosis and insulin resistance. Whether you're dealing with these conditions, want to prevent them, or simply aim to optimize your overall health, understanding this link is crucial. Today, we'll explore how metabolic acidosis affects insulin resistance and vice versa, and discuss solutions, management strategies, and prevention methods. Have you ever wondered what the connection between metabolic acidosis and insulin resistance is? These two terms might sound like complex medical jargon, but they're crucial to understanding our body's metabolic health. Metabolic acidosis is a condition where the body either produces too much acid or the kidneys fail to remove enough acid. This imbalance can lead to a cascade of health issues. On the other hand, insulin resistance is a state where your body's cells become less responsive to insulin, causing a rise in blood sugar levels. But why are we talking about these two seemingly different conditions together? Well, they're closely linked. The interaction between metabolic acidosis and insulin resistance forms a vicious cycle, each intensifying the other, leading to a deterioration of overall health. As we peel back the layers of these complex conditions, we'll uncover how they interact and explore actionable steps we can take to break the cycle. Let's dive deeper to understand the interaction between these two and what we can do about it. Let's start with diet-induced acidosis. Can what we eat really affect our metabolic and insulin health? Absolutely. In fact, our diet plays a pivotal role in determining our overall health, including our metabolic acid-base balance and insulin sensitivity. Now, you might be wondering, what is diet-induced acidosis? It's a condition that arises when our diet is heavily skewed towards acid-forming foods. These are typically processed foods, meats, and refined grains that generate an acidic load in our body. When we consume these foods in excess, our body's capacity to neutralize and excrete the generated acids is overwhelmed, leading to a state of acidosis. Why should you be concerned about this? Well, an acidic environment within the body can exacerbate insulin resistance. This happens because an acidic internal environment can impair the body's ability to effectively utilize insulin, leading to a scenario where our cells don't respond well to insulin, thus causing high blood sugar levels. So what can we do about this? The first step is to take a good look at our diet. If it's high in acid-forming foods, it might be time for a change. We can start by adopting an alkaline diet. This means eating more fruits and vegetables, which are alkaline-forming foods. They help to neutralize the acid load and restore our body's optimal pH balance. However, it's not just about adding alkaline-forming foods. It's also about reducing the consumption of acid-forming foods. Yes, this could mean cutting down on some of our favorites like processed meats and refined grains. But remember, it's all about balance, not elimination. Adopting these dietary changes could bring significant improvements in your overall health. For instance, Sarah, a woman in her 40s, switched to an alkaline diet. Within 3 months, her blood pH normalized, and her insulin sensitivity improved by 30%. Incredible, isn't it? Remember, making dietary changes can bring significant improvements in your health. So, let's make mindful eating a part of our daily routine for a healthier and happier life. Let's now turn to another key player in this scenario: our kidneys. Often overlooked, these small but mighty organs play a crucial role in maintaining our metabolic health. Both metabolic acidosis and insulin resistance can impact kidney function, setting up a detrimental feedback loop that can further exacerbate both conditions. Imagine the kidneys as diligent waste management systems in our bodies, working tirelessly to filter out toxins and excess acids. However, when a condition like metabolic acidosis is present, the kidneys may struggle to effectively remove these excess acids, leading to a buildup in our bodies. This acid accumulation can, in turn, trigger insulin resistance, as high acid levels interfere with the body's ability to respond to insulin effectively. Similarly, insulin resistance can also impact kidney function. When our cells become resistant to insulin, our bodies may respond by producing more insulin. This excess insulin can put a strain on our kidneys, impairing their ability to filter out waste and potentially leading to further metabolic acidosis. So, how can we break this cycle and support our kidney health? One key strategy is regular kidney function tests. These tests can help monitor the health of your kidneys and catch any issues early, allowing for timely intervention. Another strategy is to ensure adequate hydration. Drinking plenty of water can help support kidney function by helping to flush out toxins and excess acids from the body. Aim for at least 8 glasses of water a day, but remember that individual hydration needs can vary. Lastly, consider limiting your sodium intake. High sodium levels can put additional stress on your kidneys and contribute to hypertension, a common complication of insulin resistance. Try to opt for fresh, unprocessed foods whenever possible, and be mindful of hidden sodium in things like canned or prepackaged foods. Taking care of our kidneys is crucial in managing metabolic acidosis and insulin resistance. By understanding the relationship between these conditions and implementing these management strategies, we can take proactive steps towards better metabolic health. Did you know muscle wasting could be a side effect of metabolic acidosis? Yes, you heard it right. This condition, also known as muscle atrophy, refers to the decrease in muscle mass, which can lead to weakness or a decrease in strength. But what's the connection with metabolic acidosis and insulin sensitivity? Well, when our bodies are in a state of metabolic acidosis, it means we have an excess of acid in our system. This excess acid can trigger the body to break down muscle tissues to release amino acids, which are then converted into glucose to provide energy. This process is called gluconeogenesis. However, this also leads to muscle wasting. As muscle tissue decreases, the body's insulin sensitivity is also affected. Muscle tissue is one of the primary sites where glucose is stored and used, thanks to insulin. So, fewer muscles mean less storage space for glucose, thereby increasing insulin resistance. It's like a domino effect, where one condition triggers another, leading to a cycle that can be challenging to break. But there's good news. We can manage this situation and even reverse it. One of the most effective strategies is regular strength training exercises. Strength training helps increase muscle mass, which in turn enhances insulin sensitivity. Think of it as increasing your storage space for glucose. The more muscle you have, the more room there is for glucose, reducing insulin resistance. In addition to strength training, it's essential to ensure adequate protein intake. But remember, the source of protein matters. Opt for proteins from alkaline sources, such as green vegetables, lentils, tofu, and almonds. These help to balance the body's pH level and reduce acidosis. Lastly, addressing the underlying acidosis is crucial. This could mean making dietary changes, managing stress, or other lifestyle modifications. Consulting with a healthcare provider can help you map out an effective plan. So there you have it. Strengthening our muscles is not only good for our overall health, but it also improves our metabolic health. It's a win-win situation. So are you ready to flex those muscles and fight metabolic acidosis and insulin resistance? Inflammation is a common thread linking many health conditions, including metabolic acidosis and insulin resistance. Both these conditions have a tendency to promote chronic inflammation in the body, creating a self-reinforcing cycle that can be hard to break. But don't worry, there are management strategies that can help. Firstly, let's talk about an anti-inflammatory diet. This is a meal plan that is high in foods containing anti-inflammatory properties. Think colorful fruits and vegetables, healthy fats like avocados and nuts, and lean proteins such as fish and chicken. This kind of diet can help to reduce the inflammation in your body, and therefore can help manage both metabolic acidosis and insulin resistance. Next, regular exercise is another key to managing inflammation. Physical activity has been proven to reduce inflammatory markers in the body, making it a potent tool in your arsenal. Whether it's a brisk walk, a yoga session, or a high-intensity interval training workout, the key is to keep moving. Lastly, we cannot forget the importance of stress reduction techniques. Chronic stress is a significant contributor to inflammation and, in turn, to metabolic acidosis and insulin resistance. Techniques such as mindfulness, deep breathing, yoga, and even just taking time for yourself can help to reduce your stress levels and consequently your inflammation. Now let's meet Mike. Mike is 50 years old and had been dealing with chronic inflammation for years. After adopting an anti-inflammatory lifestyle, which included changes to his diet, regular exercise, and stress reduction techniques, he saw a dramatic improvement in his health. His C-reactive protein, a marker of inflammation, decreased by 40%, and his insulin sensitivity improved by 25% within 5 months. So as you can see, managing inflammation is a significant part of the puzzle when it comes to improving our metabolic health. And remember, every small step you take towards a healthier lifestyle can make a big difference. Managing inflammation can significantly help in improving our metabolic health. So, what have we learned today about metabolic acidosis and insulin resistance? We've unpacked the significant link between these two conditions and how they can create a vicious cycle, each exacerbating the other. We've delved into diet-induced acidosis and the benefits of adopting an alkaline diet. We've highlighted the importance of regular kidney function tests, adequate hydration, and limiting sodium intake for maintaining kidney health. We've also touched on the issue of muscle wasting and the role of regular strength training and protein intake in managing it. Lastly, we've discussed the role of inflammation in this cycle and strategies to combat it, like an anti-inflammatory diet, regular exercise, and stress reduction techniques. Understanding and managing these conditions is crucial for your overall health. Remember, managing metabolic acidosis and insulin resistance requires a comprehensive approach. By addressing both conditions simultaneously, you're not just treating symptoms, you're supporting your overall metabolic health and well-being. Thank you for joining us in the Victory Education Lounge. Don't forget to like, subscribe, and share your thoughts in the comments. Your experiences could help others on their journey to better health. Disclaimer: the information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decisions, especially those related to metabolic acidosis and insulin resistance, should be discussed with a licensed physician or qualified healthcare professional.